Life cycle of hookworm is only one host. Third stage fully formed larva is the captive form of the hookworm. Mode of transmission through penetration of skin by L3 larva during walking barefoot in dampened soil. Hookworm infection is one of the most common important causes of iron deficiency anemia in both tropics and temperate countries. One of the most small soil transmitted helminths. Hookworms are only one side. Infective form is the L3 larva, filariform larva. Mode of transmission through the penetration of skin by L3 larva during walking barefoot in dampened soil. Migratory phase, intestinal phase. और क्या हो गया? Develop in soil. So migratory phase following penetration, the L3 larvae enters into subcutaneous venules and are carried to lungs through venous circulation. Here they enter into the alveolar space and migrate up to the pharynx, and finally by swallowing of sputum they enter the GIT. So during following penetration, the L3 larvae enter into the subcutaneous venules and are carried to the lungs through venous circulation. Here they enter into the alveolar space and migrate up to the pharynx, and finally by swallowing of sputum they enter GIT. Intestinal phase, the L3 larvae mold twice in small intestine to develop into adult worms which attach to the intestinal mucosa by their teeth in buccal capsule. L3 larvae mold twice in small intestine to develop into adult worms which attach to the intestinal mucosa by their teeth in the buccal capsule. Following fertilization, the female worms lay eggs which are excreted in the feces. A gravid female of Ascaria duodenale can lay 25,000 से 35,000 days per day, whereas that of N. americanus can lay 2,000 से 20,000 eggs per day. Development in soil, eggs released in feces are immature, which become embryonated in moist, shady and warm soil. L1 rhabditiform larvae hatch out from the eggs and then mold twice to develop into L3 larvae. L3 larvae remain viable in the soil for several weeks and are infective to man. Thus, life cycle is continued. So, rhabditiform L3 is the infective form. Agents affect due to migrating larva. Cutaneous lesions, previously sensitized persons. Infective larva may provoke pruritic maculopapular dermatitis and rashes called as ground itch at the site of skin penetration. Serpiginous tracts may be found due to subcutaneous migration of the larva. Mild transient pneumonitis, migrating larva through the lungs occasionally cause mild transient pneumonitis, asthma and bronchitis. But the severity and frequency of lung manifestation is less compared to ascariasis. Laboratory diagnosis, stool microscopy. The diagnosis established by finding of characteristic eggs in the feces. Stool concentration procedures may be required to detect lighter infections. In the stool sample that is not fresh, the eggs may hatch out to release rhabditiform larvae, which may need to be differentiated from that of Strongyloidiasis. Strongyloidiasis और hookworm में डिफरेंशिएट करना इम्पोर्टेंट है. होकवर्म का नाम क्या हो गया? एस्कैरियस डुओडेनली. ठीक है. और एक और का नाम क्या है? एस्कैरियासिस. लेस कंपेयर टू एस्कैरियासिस. एस्कैरियस में तो प्रॉपर न्यूमोनाइटिस होता है ना, तो न्यूमोनिया होता है. तो कहते हैं वो कौन सा सिंड्रोम? ल्यूक हाँ, एओसिनोफिलिक न्यूमोनिया, फिर लोएफ्लर सिंड्रोम. तो एस्कैरियासिस में लोएफ्लर सिंड्रोम होता है, बट हुकवर्म में इतना ज़्यादा नहीं होता, माइल्ड होता है. बाकी मेन चीज़ क्या है कि सर्पिनियस इसे इच विच ग्राउंड इच हो सकता है, और सबक्यूटेनियस मोड ऑफ ट्रैवल हो रहा है ना लार्वा का, तो लार्वा का वो, तो उसके कारण सर्पिजिनस ट्रैक्स. फिर आते हैं लैब डायग्नोसिस. टूल माइक्रोस्कोपी. द डायग्नोसिस इज एस्टैब्लिश्ड by finding of characteristic eggs in the feces. Stool concentration procedures may be required to detect lighter infections. Stool concentration procedures may be required to detect lighter infections. Stool concentration procedures may be required to detect lighter infection. In a stool sample that is not fresh, the eggs may hatch out to release rhabdiform larvae, which need to be differentiated from that of Strongyloides. In a stool sample that is not fresh, the eggs may hatch out to release rhabdiform larvae, which need to be differentiated from that of Strongyloides. The diagnosis is established by finding of characteristic eggs in the feces. Stool concentration procedures may be required to detect lighter infections. In a stool sample that is not fresh, the eggs may hatch out to release rhabdiform larvae, which need to be differentiated from that of Strongyloides. Discuss of the chapter. अब आते हैं eggs of hookworm. Hookworm eggs are oval, measure 16 to 40 micrometers, surrounded by thin eggshell, not bile-stained, appear colorless and saline mount. Ovum embryo is segmented, comprised of 4 to 32 blastomeres. There is a clear space between the eggshell and the embryo floats in the saturated solution. Eggs of both ascaris do ordinarily, and Americanus are morphologically indistinguishable. Egg counting, the number of eggs per gram of stool, can be counted to estimate the disease burden in the individual as well as in the community. The WHO classified the intensity of infection based on egg count, which is directly related to associated morbidity. Various methods are Carto-Cart's technique, direct smear method of Beaver, modified Stoll's dilution, egg count method. Stool culture, the freshly passed stool samples can be cultured so that the eggs hatch out to develop L3 stage filariform larvae. Antiparasitic, the antiparasitic drugs like albendazole 400 mg once, or mebendazole 500 mg once, or pyrental palmoate can be given. However, due to widespread use of the drugs, their efficacy is decreased compared to the past. Resistance to albendazole and mebendazole has been reported. Mild iron deficiency anemia can be due to oral iron and folic acid. Severe hookworm disease with protein loss and malabsorption warrants nutritional support and oral or parenteral iron treatment. So, स्किन पेनिट्रेशन हुआ इन्फेक्टिव फॉर्म L3 से, पेनिट्रेट्स वेनस सर्कुलेशन, जिसको कहता है सर्पेंटाइन ट्रैक्ट्स, सर्पिजीनस ट्रैक्ट्स. Carto-Cart's technique, direct smear method of Beaver, modified Stoll's dilution, egg count method. ठीक है. वीनस सर्कुलेशन से हो गया लंग्स, स्वेलोइंग ऑफ स्प्यूटम, वही फेरिंग्स वाला लफड़ा. फिर जीआईटी में जाके हुकवर्म्स और स्ट्रॉन्गलोइडस का अलग है. हुकवर्म में क्या होगा, लार्वा डेवलप्स इनटू एडल्ट्स, मेल एंड फीमेल. फर्टिलाइजेशन से क्या होगा, अनएम्ब्रियोनिक एग्स एंड फीसिस, और फिर एम्ब्रियोनिक स्टेज एग्स, फिर L1 L2 L3 बाहर, और L3 फिर से वापस अंदर. एंटीपैरासिट. अब आता है स्ट्रॉन्गलोइडियासिस. स्ट्रॉन्गलोइडियासिस इज सिमिलर, ओके, caused by intestinal nematode. So ये दोनों क्या है, nematode है. Hookworm is a nematode. Helminth है, soil transmitted helminth. Okay, hookworm के बाद आता है Strongyloidiasis. Full name is Strongyloides stercoralis. It is known as the military worm, as it was first found in the feces of French soldiers in Cochin, China. Okay, in 1876. Human infection is generally caused by Strongyloides stercoralis, and rarely by Strongyloides fueleborni. Epidemiology, globally over 600 people are estimated to be infected by Strongyloides stercoralis. It is distributed in hot, humid and tropical areas. It is particularly common in Southeast Asia, Sub-Saharan Africa and South America. Similar to other nematodes, Strongyloides stercoralis exists in three forms: adult, larva, egg. Adult worm, only female worms are seen in the small intestine of man, measures 2 to 3 mm long. Only female worms are seen in the small intestine of man, measures 2 to 3 mm long. Male worms are free living, present in the entire environment, but not in human intestine. Eggs हो गया strongyloides are ovoviviparous, that is eggs once laid immediately hatch out to larvae. Life cycle. Strongyloides stercoralis involves only one host, man. Rarely domestic pets are recognized as reservoir of infection. L3 larva filariform is the infective form. Mode of transmission: penetration of skin by the L3 larva. Mode of transmission क्या हो गया? L1 हो गया penetration of skin by the L3 larva by walking barefoot. Larva releases hydrolytic. Okay, अब आते हैं auto infection पे. Sometimes the L1 larva released in the human intestine do not pass in feces but develop into filariform larva L3 that are eventually penetrate the intestinal wall or perineal. Intravenous circulation reach the lungs. Auto infection is responsible for maintaining the infection as long as 40 years and cause disseminated infection. Similar to other nematodes, Strongyloides stercoralis exists in 3 adult worm. Only female worms are seen in small intestine of man, measures 2 to 3 mm long. Male worms are free living, present in the enteron but not in human intestine. Eggs हो गया Strongyloides are ovoviviparous, that is eggs once laid immediately hatch out to larvae. Pathogenesis and clinical feature: effect due to migrating larva. Asymptomatic infection, 50% infection asymptomatic. Rashes. Some people develop recurrent maculopapular rash or urticarial rashes that involve primarily the buttocks, perineum and thighs. Cutaneous larva migrants. Migrating larvae may produce the pathognomic serpiginous urticarial rash called as larva currents or racing larva that advances as fast as 10 cm per hour. Pulmonary symptoms are uncommon compared to ascariasis and hookworm. उसमें pulmonary था. Hookworm में mild और ascariasis में Loeffler syndrome. It occurs only secondary to underlying chronic obstruction disease. Okay. Effect due to adult worm and filarial worm. Mild to moderate worm load. Adult worms and larvae traversing the upper bowel, small bowel mucosa may produce epigastric pain, nausea, diarrhea, constipation and blood loss. Heavy larva load. Hyperinfection syndrome and disseminated strongyloidiasis are important complications observed in heavy larva load. Laboratory diagnosis: stool microscopy reveals the characteristic rhabdiform larvae. Concentration techniques can be performed to increase the yield. Single stool examination is less sensitive, 30% due to irregular and low output of larvae. Hence, repeated stool examination for samples is required. Note: sometimes the hookworm eggs may hatch in the stool, releasing the rhabdiform larva, which has to be differentiated from the that of Strongyloides stercoralis. Microscopy of specimen other than stool. Entero test. Sometimes duodenal aspiration can be collected by entero test and examined for the presence of larva. Disseminated strongyloidosis can be readily diagnosed by examining stool, sputum, other body fluids and tissue biopsies, which typically contain high numbers of filarial larvae. Stool culture: if there is difficulty to differentiate rhabdiform larvae of strongyloides from hookworm, then further confirmation L3 larva for which stool culture is performed. On freshly passed stool samples cultured, L1 larva develops into L3 within 2 days. Various are Harda-Mori filter paper tube method, Bayerman funnel technique, agar plate technique, charcoal cultured method. Serology: ELISA using crude larval antigens has a great sensitivity, 95%, and should be used when microscopic examinations are negative. However, it is less specific because of the cross-reactivity of the other helminthic infection. More so, the antibody detection cannot differentiate recent and past इन्फेक्शंस. पहला तो हो गया क्रॉस रिएक्शन विद अदर हेलमिंथिक इन्फेक्शन. दूसरा हो गया more so it cannot detect whether it's near or past. It can also be used for monitoring the treatment of response. However, antibodies disappear slowly following 6 to 12 months of clinical cure. LIPSA, luciferase immunoprecipitation, and ELISA have been developed using a 31 kDa kilodalton recombinant antigen called NIE antigen. Coproantigen detection in stool antigen capture ELISA has been developed using polyclonal rabbit antiserum raised against Strongyloiditis reti excretory or secretory antigen. It does not show cross reactivity with other intestinal helminthic infections. Molecular diagnosis, real-time PCR assays are available targeting various genes of S. stercoralis such as cytochrome C oxidase gene, 18S rRNA gene in fecal samples. They showed 100% specificity with variable sensitivity. Strongyloidiasis must, for even in the asymptomatic stage, strongyloidiasis must be treated because of the potential for subsequent fatal hyperinfection. Even in the asymptomatic stage, treated ivermectin more than 20 mg per kg daily for 2 days is more effective than albendazole. So ivermectin यहाँ पे काम आता है. ivermectin, albendazole और क्या था albendazole और mebendazole.